Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. Globally, there were over 24.7 million confirmed COVID-19 cases on the 28th of August. Over 16 million of them had recovered, and there were more than 830,000 COVID-19 related casualties. Global recovery rate was about 65%. On August 28th as well, in Nigeria, 53,477 infections were recorded in Nigeria, out of which 41,017 recovered and 1,011 died. The overall recovery rate was about 76%. So far, 394,524 samples have been tested. The number of infections in Lagos took a dive for most part of the month of August, then suddenly increased to 404 cases on the 22nd before declining again. Nigeria is now the fourth worst hit African nation, coming in behind Morocco and ahead of Ethiopia and Ghana. Let's make sense of these numbers with a consultant epidemiologist, Mr. Biodun Oguniyi, who is also the Infection Prevention and Control Program Manager at the Nigeria Center for Disease Control, NCDC. He joins us from our studio in Abuja. You're welcome to the show.
Good afternoon, Nigerians.
All right, so that's 394 plus thousand samples, but that doesn't mean that many people. What exactly does that number represent?
All right, thank you very much. Let me start by saying we have not tested enough to declare that we are now at the end of the outbreak. For us, let's say about 400,000 people who have been tested. And what fraction of that is the Nigerian population? As a nation, from the national strategy, we set out to have a target of about 2 million of our population tested. And so far, we have only done 400,000. So if we have the projected estimate of 200 million Nigerians, 400,000 of them being tested is about 0.2%. So if we set the target of 2 million people to be tested, that means we are still far behind our target as a nation. 400,000 tested, 53,477 cases were confirmed from those testing. And what does that suggest to us? That about a proportion of that, more than 20% or so, or let's say 13.36% precisely, of those cases that were tested, of those 400,000 were positive, have the cases. Now, before we can really say we are now, because I've started hearing people saying, okay, post-COVID era, there is no post-COVID era yet. We have not tested enough to declare that we can now lose the guards. We have a target going by the national strategy to test 1 million people. And in trying to achieve this, we are working with a strategy. We have been able to improve our testing capacity as a nation from where we started in February. For instance, where we started in February, we had less than 5 testing laboratories in Nigeria. And today, we have more than 66 testing laboratories. For those who are involved in this practice, we know how difficult this is to put up. And it's a major feat for us as a country. And now, in every state in Nigeria, except 2 or 3 states that are all just about ramping up their home process, almost all states in Nigeria, except 2 or 3 states, now have a testing laboratories. Whereas those who even don't have, 2 or 3 others who don't have a testing laboratory in their neighboring state. So we have increased the testing capacity for us as a country. And with this, we have also worked with all our partners, especially private organizations, individuals who have been really supporting this with the government leadership. And we are able to say as of today, we can now, we now have a testing capacity of 10,000 per day we can test 10,000. But as of today, we can only test less than 4,000. I mean, we've been able to test just about 4,000. What does that mean? People are not coming up to test again. So testing has reduced, and that seems to be giving us the lower figures we are getting. And we have not even reached our target. And so with that, we're looking at increasing our testing capacity in these various states across the country. So we have been working, collaborating strongly with all the states and the federation, for instance. And they're doing very well in this. Some of them still need to be encouraged to do more. For instance, the approach now is to ensure that in every local government area in Nigeria, there should be a sample collection site in every local government areas in Nigeria. From those sample collection sites is where samples are taken to their testing laboratories, for instance. And so if we're able to achieve this, we would have increased the ease of access to testing for Nigerians. They would have been able to have a free walk-in areas where they can go in and get tested. So until we have been able to achieve that, able to test 10,000 per day, that means we will need about 6 months to have a target met, a target of 2 million. But what we have, what does that translate to? That means we expect, plus or minus, based on proportional allocation, states should be able to test 300 persons per day. And we are really far cry behind this target for now. So until we are able to test sufficient enough from our population, and we can no longer get, let's say for
Mr.
instance,
Guni,
to do
let me
our
quickly cut in.
rate.
Let me quickly cut in here. Let's just look at the Lagos figures. You know, Lagos went really down on a certain, in fact, we've gone down to like 17 in a day. And then went up again, 404 on the 21st or 22nd of August. What does that mean? Are you saying we are not flattening the curve in Lagos? Is that what you're saying? And what does that 404 mean? Why did it go so high on that day?
All right. Okay, straight to that. There are factors responsible for fluctuations in the figures we get daily. For instance, days that they test on weekends, there are facilities that don't test on weekends. If you don't get to test on weekends, then by the time you are reporting for those days that people are not testing, the cases will be lower because they are not testing. We have also identified that there is influx of, the rate at which returnees are coming into the country varies. So the days you have more returnees returning, you definitely have more cases reported. Where you have less returnees reporting. Less people tested in those places. And so these curves, we keep in that direction based on the flow of how people come up to get tested. So the idea of flattening the curve, it will be too early to conclude on that until we can be able to say, okay, from our population, let's say in a population of 20 million in Lagos, what proportion of Lagosians have been tested as at today? If that proportion is significant enough to give us, let's say, a positivity rate of less than 2%, then we will be able to say, okay, compared to population, the denominator of Nigeria, of Lagos state, then it may be a lot easier to say, okay, maybe things are now stabilizing, we can't start relaxing the gap. But that is not where we are now. With the national figure of 13.6% positivity rate, I think we still have more work to do. Okay,
now, you're saying that does not mean we're flattening the curve yet. But is the behavior so different in states that Lagos, Lagos was the epicenter, they should know better. Lagos is testing as low as 17, but in Plateau State, the numbers are going higher. Is it that they're more aggressive with their strategy, or what? What is happening? What do you think is going on? And why do you think people are not coming out as they should?
Okay. So one of the factors responsible for why people are not coming up is ease of access. Some don't even know where the testing centers are or the sample collection centers, where they are. Some don't know. And some have also been victim of the social media noise about the fact, the scams around what is happening. So others feel it is not real. And so to a large percentage of those who are not ready to get tested, who think it is all other symptoms and not what they are calling it, they don't come for testing. And so we have also a great population of asymptomatic persons in our population as of today. One of the symptoms that you hear people around now talking about, which they are not linking to COVID-19, is lots of taste and lots of smell. Some just feel, oh, it's just catarrh that I have, or it's just malaria that I have. But some of these indicators have been seen as the major markers for COVID-19 in our population. And Nigerians are not going for testing as expected. In fact, some states in the country are reporting low turnout, low patronage. The people are ready, the testing labs are ready, the centers, collecting centers are ready, but they're not coming. Now, what is happening in Plateau State, for instance? In Plateau, we gathered that the government decided to test all civil servants as they are returning to work. So the more seemingly asymptomatic population we test, the more contact of confirmed cases we test. For instance, if in your institution or in your organization, you've had confirmed case or you feel your people have been exposed, you just want to do a screening for them, you want to test them. If there have been contact of confirmed cases around, if you test them, you find out that you get more cases. But as like for Plateau, that's one major factor we found, that as they test the civil servants, we found out that they are getting more cases that are asymptomatic. And as at today, more than 75% of our cases are actually asymptomatic. Some of them are doing a lot of home care and all that. We don't need to go into that yet. And so in understanding these, the more people get tested, because look at it, Mary, this is now an era where a lot of Nigerians are not using the non-pharmaceutical interventions again. The issue of social distancing, they are not complying. The issues of, as expected, the issue of use of face masks, they are not doing it. So it will be difficult to now think it's such a period that the cases will just disappear. Then that means we are not getting the transmission right ab initio. So we are very clear about this.
Let me cut in here.
It is not Uhuru yet.
Do you think that we are getting sort of used to this infection now and we are having more asymptomatic cases than we used to? Do you think that also could be a factor?
People are having pre-symptomatic phase. It is just that they feel until they have cough before they can say, okay, maybe or a prolonged cough before they can say they have symptoms. They are having these symptoms. They are just not coming up for testing. And I tell you, if you gather a sample population together and screen all of them, get all of them tested, you will see the cases are rising. And that's to tell Nigerians that if we now get back to this structure that we are establishing at the local government level, that people now have better use of, like I can see that Lagos is doing very well in that regard now. The centers are open. Every local government, we are looking at, even at the general hospitals level, they open up for sample collection. It's not as if they test in those places. They get their samples collected. And so when more people are getting tested now, you will see that the coughs will pick up again. Very soon now, you will see one of the conditions of for returnees and those who are traveling out is that they need to get tested. They go and test. It's not because they are symptomatic, but it's now a criteria, one of the criteria. When they get tested, you will see that we have more cases. So these cases will rise again because we have a lot of community transmission ongoing. And I'll tell you this. As at today, we have 573 local government areas out of our 774 reporting cases. So we still have about 200 local government areas that are silent. Now, what are we doing to improve on this? We have now reviewed the criteria for testing. We said that's what we call the community case definition, meaning if anyone has, look at this symptom, fever, cough, or both, with any other symptom, he or she already fits into a suspected case of COVID-19. And so in all our health facilities, now we're looking at how everyone who presents at health facilities gets tested. Because for you to come to an health facility, at least you will have some symptoms that you're presenting with. So when you get them tested, you have more cases, definitely, because they are already in the community. And even though we think that things are going down, we have new local government areas that are reporting, that were not reporting before, that are reporting confirmed cases. So community transmission is ongoing. The figures are not rising because our testings are not meeting our target yet. If we are able to test on a daily basis 10,000 cases, and in subsequent months we are able to reach our target, and we can now look at our positivity rate. If it's now very low, like less than 2% from where it is presently at about 14% or more than 13%, then we can say, okay, the curve is really flattening for real, because we have a sizable sample of a population to be able to work with. That 2 million target is even the minimum we set for ourselves. We could go as high as 5 million if every state, as we are doing now, working hard to get them tested. So we are opening those opportunities in organizations. People can come up for testing of their staff. Contact of cases now are being tested. And so with this, it's going to give us more cases, and then If over time, it's not as if people are just adjusting, it's just that they feel that they are not symptomatic. And come to think of it, most viral infections are self-limiting. And that is the guise that is giving us this.
We've got to go on a break now. I can see that you have lowered the bar for classifying possible COVID-19 cases. Cough, fever, one other symptom. We're going on the break now. When we come back, we will continue. Welcome back. Call 0805-468-3514. If you have any questions, the number is appearing on your screen right now. And you can also tweet at CTV_Mary A. Now, let me quickly take this question that was sent in on Twitter by Amin. He says, I felt some COVID symptoms months ago. I got tested and didn't get my results until today. What could that mean? So I'm throwing that question to you now, Mr. Oguni.
Right. All right. Okay, so maybe that will take us to answer the issues of what our discharge criteria is now as a country. You remember in the early part of the outbreak, we started by having the condition that before people can be discharged from isolation centers, they need to have tested twice within the interval of at least 24 hours after their symptoms subsided having 2 negative results in that regard. But over time, based on available science and evidence, WHO, the World Health Organization, was able to come up with the understanding that the virus itself does not have the ability to survive on its own after a particular number of days. And how did they arrive at this? Within our body system, the way the body responds to the infection, there are things we call the neutralizing antibodies that tend to attach to the viruses. When they attach, they tend to reduce the power of that virus to infect. And these neutralizing antibodies in human beings are released within the first week, within 5 to 10 days of the onset of an infection. And when this happens, studies have shown that as at 9th day, even when you see those viral particles in an individual, they are not infectious again, they are not able to transmit. And this was really well established in well-documented studies. And with that understanding, WHO came up to review the guideline. Let's not forget, this is a novel virus. Nobody can beat his chest to say, I'm a professor of coronavirus understanding. No, everybody, as new evidences are evolving, as new researchers are coming in, being a novel virus, we are all evolving. I know this is a very challenging part. So in that understanding, WHO on May 27th precisely reviewed the guideline again, the case management guideline, and said, okay, with this understanding, everyone who is asymptomatic, for instance, I mean, you don't have a symptoms, and you have been tested after 10 days, since testing have shown that the virus cannot even be cultured again after 9 days, then after 10 days, the likelihood of that person being able to infect anybody else is almost not there. So after 10 days, such individuals can be released to go. But that for those who are now symptomatic, the WHO advises that they should have additional 3 days plus 10 days. So that's like 10 days. If the minimum is 10 days after you have been after the person has started his symptoms, then after 10 days, you had 3 days more. So if, for instance, let me explain that clearly so that Nigerians get it right. If the person presents today and the symptoms persist for like 10 days, and after 10 days the symptoms stop, you had 3 days. I mean, to that's the WHO recommendation. As Nigeria, for Nigeria, we even made it 4 to err on the side of caution. We had 4 days to that, and after that the person can be discharged now, even if the PCR result still says it's positive, because presence of those viral particles have been shown at that level not as risky again for transmission. There's not a risk for transmission.
Okay,
so in
so
that
what you're
case
saying,
of an individual who has tested,
what you're saying is that what you're saying is that Amin shouldn't bother anymore. Meanwhile, in his case, he wasn't admitted. He was just tested because he had COVID symptoms, and then he didn't hear back from the NCDC.
Okay. So you will remember that we had an upsurge of discharge in the country at a point, and that was when states started adapting this new policy, new directive, new guideline of WHO. So with that guideline, if the person is not having symptoms again, there is the home care component, which WHO also advises, and there is the isolation care component. So those who are mild or asymptomatic, they can be given through the guidelines to have home care. That is established globally. While those who have severe and moderate cases are moved to isolation centers. They have their home management treatment. So for that person who was tested symptomatic and has been more than a month, obviously it's good to find out whether she's still having symptoms. If she's not having symptoms again, when last was that? And if it is more than 3 days without, if it's an asymptomatic case, or with a symptomatic person and it is more than 13 days, now for Nigerian cases, 14 days after your symptoms started and you don't have any symptoms again as of today, those are the cases that the country, the individual state is expected to reach out and confirm their situations and count them among those who have been discharged. It's so difficult to track those things, but most states are really doing that. And that's why you see some states declaring we have discharged X number, these figures, and people are like, how did you do it? Those are the new protocols now based on the new evidences that if you have exceeded that period, you can't be discharged.
Okay. Now, let me just quickly ask about students, exit students who are taking exams now. If you have somebody coming down with COVID-19 symptoms while taking these exams, what is the best way to evacuate that person? How would you handle the situation to contain it as much as possible?
The Ministry of Education, working with NCDC and other partners, they've set up guidelines. We've had a lot of periodic engagement with teachers, with school proprietors in the last couple of months before this school's opening issue came up. And they have all been provided with the needed guidelines. The infection prevention and control recommendations have been shared with all the schools that are opening through their leadership. And so one of those things is that they should have a temporary isolation room or area in their schools where if there is any student with COVID-like symptoms.
Just a minute. Let me take this question from DK in the UAE. Hello, are you with us?
Yes, I'm here with you.
What's your question?
My question is simple. I just listened to the epidemiologist about this coronavirus issues, and there was a tweet from someone who mentioned that she had the test and had no result, and I don't know what the young man is beating around the bush for. Can we get a reason why this result was not released? You want to ramp up testing, and yet people are not getting results. So how do you expect people to respond to your testing system?
Okay, thank you very much, DK. Let's get Mr. Oguni to answer that question.
All
He's
right.
worried about
thank you very much. I got that. Thank you very much, DK. We identified that challenge based on certain logistics issues in states that have reported such instances. And as a country, we've now started piloting a more technological advanced way of ensuring that everybody who is tested now will get a code wherein they can go online on their own and input that code that is specific for them, and they can log in and get their results. Now, you must appreciate with us, you'll be able to appreciate with us that a lot of logistics issues involved in this testing process. Most times, it is not because the results are not ready, it's just about how to get it communicated to some of these clients. But this is a challenge that we've identified and is being resolved. And one of the quick ways we want to get this fixed is to ensure that that platform, as soon as we've piloted it now, and if it has achieved that purpose, it will be rolled out across the country where people can get through their SMS, their codes based on their testing they've done, and they can go to the site where they can check their results on their own. So in the next couple of weeks, we want to believe that this challenge will be put behind us. And thank you for bringing that up.
Thank you very much, Mr. Oguniyi. On that note, we've come to the end of the program. Do listen in again at channelstv.com/podcasts and stay safe. I am Mary Alale Yusuf.